get ready to go over to the other side. Oh my goodness. Oh, okay, shut up. We're getting ready to go over to Facebook. Where's my phone? I just had my phone. Okay, I'm gonna make it public.
Cool.
And we're back with part two, right? COVID airlines. It's not Kingdom. Okay, here we go, guys. You can. You can. It ain't gonna bother me while I'm on. Okay, guys, we're on the live page, I do believe. So everybody, um, we are officially live as we speak. I see y'all smiling. Hi, everybody. We're gonna go ahead and get started at this time. You all can go ahead and start, tagging your people as we get ready to come on, okay? So let's get started. We're gonna start sharing and tagging our
And
live,
sharing and tagging.
okay? So I'm gonna go ahead and tag a few people. Yep. Okay. We are officially on live right now. All right. We're on live. Hi, everybody.
Hello.
You all can still go ahead and continue to connect. Are you being able to connect pretty good?
Yes.
Wonderful, wonderful, wonderful. Hopefully, everybody's had an excellent day. Um, we're back again to finish part two of our discussion as we were talking about COVID-19. We were talking about hair loss. We was talking about hair loss versus shedding. We just kind of had a culmination of things that we were talking about. And it is so funny that we're on this subject. I am glad to be here, first of all, and I want to welcome everyone to Let's Talk About It Tuesday. I am Dr. Suzette Robinson, and I'm here with Dr. Pam Hill. I'm here with Dr. Rashawn Broadnax, and I'm also here with this professional, Marguerite Moten. And we're here today to help, hopefully, we can shed some light on some questions that have been asked, by us for us to give answers concerning COVID-19. And it's amazing that we're talking about COVID-19 because that's the big topic right now. That's what everybody's getting prepared for. We're in the cleaning mode. We got to have the disinfectant. We got all of this going on. But this is what's happening on our end. We're seeing the results that people are losing their hair. So, and it's amazing that we're talking about it for a second week, a second time rather. I had a call earlier, you guys. This young lady called my office and was inquiring about the results of her having COVID-19, and she's experiencing severe shedding. Okay, so we're going to indulge in this conversation, and hopefully people will write in and as we're talking. But however, if they don't get on live this time, they'll see our replay, and hopefully we'll said something that will give them answers to their questions. Okay, so let's get this thing started. How about that? Who want to be the first one to start this off? Y'all take too long. You know how I do it.
Well, go on and start it off.
Well, you know what? One thing I want to say about this situation, because COVID is happening, a lot of the side effects we're not familiar with because this is new to us. Okay. So when someone calls me or they're talking to me about having issues after and while they're going through the process of coming out of the COVID situation, they're always talking to me about shedding. Okay, so it made me study, which I did find some facts on people actually experiencing hair loss during their COVID experience or whatever. And so it's real. Not only is it real, it's real with different things that they're using, even the vaccine, because there is a property that's in that vaccine. One of the side effects, one of the major side effects, and it was in big, bold letters, was hair loss. This is my concern, or this is my opinion or thought about this, is that I know we're trying to combat this situation, but I do think people need to be aware of the side effects of anything that they take, especially when it's dealing with their crown. Okay, because that can lead not just to the fact that it's startling to wake up and your hair is gone and you don't have any answers, but it runs up the stress level. We got all this that we have to combat as professionals. So I do think this conversation is very, very, very important, not for just us as board certified practitioners and trichologists and specialists, but what about those hairstylists that's going to see this sitting in their chair? Okay. So that's a big discussion. That's a big door opener. Anybody want to care to join in with that conversation?
I agree with you 100%. It is a big door opener. And then we as stylists need to, ask more questions. We have gotten away from doing a consultation and finding out what they actually taking, even if they're not coming in for hair loss, especially more now that we've been shut down and a lot of clients have been at home doing hair more, than normal. Meaning they go into the store, getting the box relaxers, they getting the color, they getting everything to try to maintain what they are used to. A lot of people don't want to see grays, or, they don't want their hair to be, not relaxed or even natural. So we go through so many different things, and a lot of times we don't read the side effects of different medications that we take, or just anything, period. Even vitamins. There's so many different things, and people that realize, your hair could shed for having a high fever, which pretty much the virus, some of the side effects from the virus, a lot of people did not get any fevers or anything, but a lot of times when you get a high fever, it forces your hair to go dormant. So, it pushes it into that resting stage, which will cause more shedding. So I think we need to just educate a little more, read up on different things. A lot of people, like you said, were taking a shot, not against it, not for it. So to me, it's to each his own. But I think just with doing things, we definitely need to find out what the side effects is, so that way we can nip it in the bud from there.
That's good. And so to be honest, a lot of the information that they're going to get is going to come from you and me.
Right.
And the stylist or the barber. Even you cannot rule out the barbers, because those people sit in their chair as well.
Right.
Okay. And y'all, you know what? This is a conversation we cannot avoid. We
Right.
can't avoid, and all this cover up. I often think about times, you guys, that I have covered up things that I didn't know about. Okay. Didn't realize I was doing more damage than I was doing good because, hey, put a wig on it, put a weave on it, you know what I'm saying?
Mhm.
But what do you do when you ain't got nothing to connect nothing to? And now it's developing into a situation where it's going in the bloodstream, where it's, and it's getting so severe to that, it's just people are experiencing situations where their scalps are so irritated, you can't even put a wig on top of it.
Right, tender. So
Mhm. Mhm.
And it has gotten so bad to where it's breaking the skin. And now what's happening? Now you got another issue.
that's it.
Okay. Marguerite, I know you had a client or somebody that you were telling me about. Can you share your information with us?
I sure can.
Okay.
I was sharing with you early on about one of my clients, and we was sitting back and we was just trying to figure out, what could be happening to her hair.
Wow.
Weeks she came in, couple of weeks she came back, and her hair was at a different state. And so I come to realize, as of yesterday in my study with COVID-19 and hair loss, and my study, I discovered that her condition was stress. And what made me go to her condition of being stressed is because she was so antsy and so tense about just being around people and
Yeah, okay.
and not want to be outside and just want to be the only person in the salon. And my findings in my reading saying that stress is the top 20 symptoms
Top
of
20.
hair loss.
Top 20.
So that made me think, and I had to give her a call because I wanted to share that information with her, because we was trying to kind of weigh it out to see where it could be coming from. And I'm glad that you gave us that assignment to be able to, because you know what, before you gave us the assignment, I don't think nobody even thought about COVID had anything to do with this hair loss. And in my finding, I found out after the fact that you dealing with COVID and stress and anxiety,
Mm,
your hair doesn't start to shed and come out until like 3 months after the fact.
After.
And then if you don't allow it to get to a devastating stage, it will come back, but it will take 6 to 9 months.
Okay, that's
So
good.
so
That's
you
good. Because you know what, Marguerite, not to cut you off, but this young lady that called earlier, the first thing she said was, they explained, she went to a dermatologist first, and I want y'all to hear this, professionals. This is what we up against. The dermatologist, of course, was talking about telogen effluvium. We know that that's a disorder. We know that it's treatable, but we also know the danger of it if it's not caught in time. So, a lot of people, y'all, and I hope those of you that's listening will really listen to what we're saying. A lot of people are keying it in. Y'all know we love Google, we love YouTube, we love all of those things. But there are some things you actually need to go sit in a professional's chair and get proper diagnosis and a great solution, one that will work for what's going on your scalp, in your body, And so she said, she expressed to me, I went online, I looked it up, I came up with telogen effluvium. Okay, terrific. You still need to be examined by a specialist. Dermatologists, yes, they go in, they check the skin, they can check your skin because this is your skin. But when it comes to that hair, when it comes to what's going on inside that hair, that's our department.
That's right.
And I think sometimes, because people hadn't really talked about trichology, so much. I think now it's like a fad. I'm a trichologist, I'm this and I'm that. That's fine. But an operating professional is different because we study all the time. Am I right, Dr. B? All the time. And when I was in school, elementary school, you know, I was like, oh, I'll be glad when I get through elementary school. Didn't know I had to go to high school. You got to study there. Oh, I'll be so glad when I get through with high school. Then, Mom, you got to go to college or get a job. Oh, I think I'm going to school. So it's a forever situation where you're going to always learn. Now, in our profession, because people are sitting in our chair and we're seeing all of this. Now, COVID, yes, we got to get educated on COVID, how it operates, what it does to the body, the whole 9 yards. My client said, why do you have to know about the vaccine? Because if you're taking that vaccine, it's going to feed the area that you're going to bring to me.
Mm-hmm.
So I need to be wise enough to know what you're bringing. So if something happens, I'll be able to help you. Y'all agree with that statement?
Yes.
Yes, ma'am.
So telogen effluvium, we done heard that. We all have studied that. People come in that look at it on Google it. I guarantee you they don't understand exactly what it is. If you had to explain it, what would you tell them?
Well, I'll tell you, I actually found a very simple breakdown of what it was, which I thought it was something that I was looking for because I said, you know, we get the scientific and we understand because we've studied.
Right.
But when it comes to translating it to a client, you know, the best way, you know, breaking it down to the brass tacks is the best way to go. So the definition that I saw basically said was it's a scalp disorder characterized by thinning or shedding of the hair resulting from early entry of the hair into the telogen phase, which is also known as the resting phase.
Boy,
Yeah.
boy, you got to
Now,
that's great.
the hair cycle is in 3 different stages.
Yes.
So, you know, when it's saying that telogen effluvium is when the hair goes into that or sheds while into that resting phase. So it also says it is in the phase, it is in this phase that telogen hairs begin to shed at an increased rate, where
Wow.
normally the approximate rate of hair loss having no effect to one's appearance. So that's like our normal hair loss.
Okay.
125 per
Right.
day,
Right.
you know, but because of the telogen effluvium, that will be increased.
Okay.
And that's why you start to see the patches, as we call it, or the, you know, the circular areas where the hair seems to have fallen out at a much more rapid pace.
That's good. That is so good.
And just to piggyback off of what he just said too, a lot of you know, clients don't realize that you have a natural shedding of 125 hairs. When you tell somebody that, they like 100, that's just a lot. You know, they think it's a lot, and it's not a lot if you have the full capacity of your hair. If you don't, yes, then it is a lot. So a lot of times clients don't realize that we have normal shedding just as well as our skin. We shed. So a lot of times you don't understand, you know, that, you know, oh no, my hair doesn't shed. Yeah, we shed. We shed.
That's good. That's good. You know, because look, we're here to educate. And you know what? To be honest, this has, like Marguerite was saying earlier, people are so distressed, you know, and I think she was sharing with me about a client who, you know, sometimes, they so to know that this is going on and it's so deadly. And then when it hits close to home and you lose people that you know, then you say, well, I can't go out. I can't touch this. I can't do that. I can't do that. You know, everything is a panic. Right then and at that point, the body goes into this shock, everything. And I'm gonna tell you something, everything gets out of whack. I don't know if y'all remember that chart I gave y'all one time, told you about every emotion we have, how it
Mhm.
affects our main organs. Stress is a silent killer. It comes
Yes.
upon you, you don't even know. A lot of people stress and don't know it.
And I was just getting ready to say that
You
you ask the
know?
client what their daily, routine is, and once you hear, it, you be like, okay, that's a lot for you to be doing. Just like you don't get no rest. You got to
Wow.
wake up in the morning. You got to get your kids together. Even more now that the kids are virtual.
Yeah, that's a
So you got
whole,
to
that's
get
a,
them up. You got to cook. You got to clean. You got to work. You
yeah,
got to be in traffic. It's so much to. They don't realize that they're stressing until they
absolutely.
actually see it in their hair or in different areas of their body.
And
Not just hair. So
that's serious. That's
it's
serious.
very serious.
And it can be so bad they can wake up and the hair that they have on their head could be
It's
on the
gone.
pillow.
Mm-hmm.
Yeah.
And then one thing I was sharing, not to cut anyone off, I
Go
was sharing
ahead.
with my young lady today that she had to get to a place where she have to learn to try to reduce her stress. She have to
Mm.
find ways to reduce her stress. And a couple of ideas that I was sharing with her is to, if she need be, just take a couple of walks or laps around inside her house. Take a couple of deep breaths. If she feel like, I need a little bit of music or something just to comfort her, because if she constantly stressing, it's not going to make this situation no better. So she have to find ways to comfort her so she can lower her stress levels.
That's
Absolutely.
good.
You know, it is
That's
funny that Marguerite should mention that because last week we talked about self-care. And so it
Mm-hmm.
falls into that. I think it's important for people to learn themselves and understand how their body works so that they will be able to adapt those properties. They'll be able to
Right.
bring down those stress levels. When you understand the things that comfort you, or the things that kind of calm you down, then you're able to
Right.
go to those things and
Mm-hmm.
do those to kind of help bring your body back into a mode of homeostasis, because
mm.
that's actually what's happening is we knock
Right.
it totally off, with the stressing. So I think it's really important. That was a great point to bring up.
And that's good because that's why it's so important that we have such a comforting area for them when they come, because I have noticed that when you have a place where they can come in and if the music is soothing, y'all, and I'm gonna laugh, okay? Music, depending on what kind it is, I can either have you racing or it can calm it can calm you down. So if they're coming to you as a professional, and this is what I want to say to the stylist, listen, it's a different it's different than being a stylist and then being a specialist, because we specialize in comforting, relaxation, restoration. We that's an area. So it's not a racy time. It's not people coming in selling stuff while you do. Everything is really planned out. And I remember in my early years when I first started in the salon, it was like on Saturday, it was like popping, the man was outside cooking food and people were selling stuff and, you working, people coming up, hey, you want to buy these CDs? Hey, you want to buy these? That was that. So people got immune to that, but then
Mm-hmm.
now people are dealing with trauma.
Right.
And it's manifesting on their scalps, skin,
Mm-hmm.
Internally.
they have a gut problem. All this we've got to tackle.
Right.
And now we're dealing with COVID-19. So now we got precautions we got to take just to have them come in. And it's nothing like what we used to. Nothing like what we're used to. We used to, when people come, we got to now take their temperature. They got to fill out papers. We got a lot we got to do even before they come in.
Right.
Okay. So let me ask you something. When someone asks you and they haven't told you that they dealt with, because it's kind of like an issue where people don't really want to really go into details about their personal life, and they may not ever tell you that it was an issue or that they experienced COVID or just got over COVID or whatever. But they're sitting in your chair, you looking at their scalp, so something traumatic has happened.
Mhm.
Let me ask you something. How do you talk to them, or how do you get to that place during your consultation to get them to open up to you?
For
Well,
me,
one
what
thing,
I've oh, go ahead.
no, I was gonna say that for me, for them to be comfortable and to be open with me, I always say, we can't be a team unless we are truthful and honest to one another. So in order for me to be able to help you, we have to be open and honest. So that's one of the approaches that I, take in doing my consultation, because, we can't grow and do this thing together if we are not open and honest with one another.
That's true. That's true.
And for me, what I found out, just been doing this, for so long, is actually having a private room. Really, that's helped me a lot. And
Right.
a simple fact to the fact that I've always worked in a salon with more people. So when I realized that, that one-on-one time, even if you did it earlier prior to anybody being in the salon, having that one-on-one time give them more comfort of opening up and just sitting down and actually, because a lot of times, like I said, a lot of stylists or barbers stop doing consultations to where you actually sitting down before you do anything. A lot of times it's like, hey, we go straight to the shampoo bowl. You're not analyzing the scalp. You're not doing anything. So customers got so used to just going straight to the shampoo bowl or not actually having any type of communication. So when you sit them down and you ask them questions, they looking at you like, okay, wait a minute. Like, this is something new. I'm not used to this. So you get to knowing exactly what they want. So they get a little more comfortable, and then they be like, okay, well, you know what? Yeah, well, I take this. They give you more information about their life. They give you more information about the medicine that they take in. They more
Absolutely.
open when you have that
Absolutely.
one-on-one and you by yourself. Outside of that, they clam up.
Good.
They don't want nobody else to see their hair. They
Yeah.
just like really frigid or,
Yeah.
uncomfortable. So I find that to be easier to have either one-on-one or actually come in earlier or either maybe later if you work in a salon. So I think that works better.
That's good. That you listen. That was a great point, because
Mhm.
everybody does not have the luxury
Right.
of having a private room or anything like that. Now, I choose to go strictly clinical. So
Mhm.
that kind of like, so don't take walk-ins or nothing like that. It has to be
Right.
strictly by appointment. But that's something I chose to do, right? Because people come in, they've got to expose them. They be embarrassed to show me their head. And
Right.
God knows I got to see it in order to work with them. So I see what you're saying, Pam. But so yes, if you're a stylist and this is what you're doing in your office or whatever, if you got other people, book those people when there's really nobody there.
Right.
Or you until you can get to that place where you can get your own personal spot, because people really want their privacy and you want to give it to them. But this, I was reading something. I'm gonna read. Shanae Starnes is on here. She says that privacy is important and actually required. It is required because, and y'all, even if you're working with someone and you're like in that setting and you're talking to your client, y'all know how we get sometimes. We'll come off up in there. No. If you start out right, and I mean this, how you start out is how it's going to end up.
Right.
Right.
You have to let people know, hey, this is a private area. If ain't nobody, and people you love saying, well, your son came by here and said, if he ain't bleeding, a bullet, I can't help him no way. Tell him to sit down or wait until I'm done. He cannot come. I need to see my mama. See, respect is due, but we got to learn how to set it up
Right.
where that will happen from the beginning.
Right.
Okay. So my question that I often think about is when this is one question that came through. I want y'all to hear this. Why could COVID-19 cause hair loss?
Why can't it?
Why could
Because
it?
it's a virus,
Ooh.
and most viruses actually cause issues with your organs, which actually goes through your bloodstream and go through the follicle of your hair. So that's one of the reasons. Then again, viruses cause fever. That's another reason. So it's so many different things. It's just not even just COVID that causes hair loss. Normally, any type of viral or bacterial
I like
infection
it.
can actually cause any type of hair loss. Same thing why sometimes you get splashes on your skin because of a high fever, or it's so many different things. So when your body, something's happening to your body, it actually normally comes out through your skin, which is our hair, and comes through the follicle. So
That's
that's
great.
one of the main reasons.
Yes. Somebody been studying.
That's good.
But you know what? If we didn't have this conversation and never talk to people about it, it would just be a mess. And some people would be covering up. Like I said, that time when I was ignorant, just covering it up and causing more problems. This
Right.
question came about, and I'm glad that you answered the way you did, Pam, because Dr. Pam, because first of all, people got to realize if you're losing hair, nails, teeth, whatever you might be losing that you should have, it's a manifestation that there is something terribly wrong on the inside.
That's right. That's right.
So that lets us know how important it is to eat correctly, think correct. I got to say think, because honey, that's part of feeding too. Because if you are not careful on how you treat this, you want this to last a long time and to be very productive. Think about it. You want your legs to carry you around, but you treat your legs bad.
Right.
Duh.
Right.
I mean, come on. So you want your brain to function. Put the right things in it.
Right.
We want our hair lustrous, but see, we in this time now where weave is queen.
Mm-hmm.
But sometimes I want to show my own hair. Now I do like to wear it. Don't get me wrong.
Like you said.
I'm not gonna take it off because I said that. But
Right.
because I'm gonna put some more back on. But listen, but even with that, professionals, if you're on here listening, if you're a person that's sitting in someone's chair, if you're going to wear a wig, weave, or whatever, make sure you're getting that scalp treated correctly. It is so important. Anybody that come and I make a wig, Dr. B, you know, if you make a wig for somebody, you're going to suggest, hey, this wig is I like it and everything. It look good on
Right.
it. But we must make appointments to get that scalp treated. Even
That's
my
right.
people that are totally bald come get their scalp treated.
The scalp.
That's right.
it.
That's right.
The
And
healthier
that's something
your
that we
scalp-
have to do. We
Yes.
have to do that as stylists. Like my
Yes.
clients, I let them know, like when you get a weave, okay, first of all, it's not staying in there past 6 weeks, 4 to 6, depending on what I did.
Okay.
Because you
okay.
already know, because I'm that stylist, like, no, we're not doing it. And I love
That's
money,
right. That's right.
but I love more health of the hair.
Mm.
So we are not doing that. And, you know, I'm a contract queen when it comes to certain things. So
Uh-huh.
go ahead and sign this because it's going to stay in 4 to 6 weeks. And you're going to come back and let me properly take it out. You're not going to take it out. So these are the things that I need you to do if you're going to have me doing an install. So
Now,
we have
that's
to educate our clients
Yeah.
because they are trying to take it to the end of the
Yes.
world.
Mhm.
And that's
They
when
will
we
leave
have
something
problems.
in for 4 months, 5 months,
Yeah.
and then they have all these disorders of the scalp, but then really don't
How long you
want you to
said? 4
actually.
months. Did you say 4 months?
I've seen clients 4 to 6 months
I
with
started
a
itching. I
weave.
started itching.
Yes.
And then some of them don't even wash. So
And
you can
right.
even imagine what it looks like underneath. But
They
that's
just
a,
pack
that's a,
on and pack on cold washes to try to make it smell good, and it's a mess when it comes out.
And a good smell good on top of a situation. Okay, so I know Dr. B got to get all of us a fan, baby, because all of us should have been doing this. And you know what? I did an exercise with the class on yesterday, and I used the Triscope. And I sent Pam some pictures. I'm not going to tell the story behind it because I don't want Pam had an answer before I'm ready. But they saw some cruddy stuff.
mm,
It was discolored.
Mm-hmm.
It was awful. It was awful. And when I revealed whose head it was, they was just really startled. And Pam, I'm gonna go ahead and tell you it was mine. But now I can't reveal exactly what that was
Right.
until y'all turning y'all papers to me. But I will say this: looking at it up under a scope is different from me looking at it with my naked eye.
Right.
Because
It's a
when
big
I'm
difference.
looking at it with my eyes, I can see it, and we will misinterpret as dandruff. We will miss
Mhm.
so many things. We will misinterpret it as, and so just think if we do it, we have the tools to
Right.
look at it. I mean, to really magnify 1,600 times or 1,000 times so we can see it.
Right.
But to people that's trying to do it at home, you're adding on to a situation.
It's building a layer.
It's just like we talk from anywhere from when you sit in that chair, we're going to talk from anywhere from your digestive tract to
Mhm.
your bowel system.
Mm-hmm.
Because your bowels tell a story
It sure
Yes, it
do.
does.
that the body's missing this or it needs this or you need to something you bleeding on the inside. It tells everything.
Mhm.
So why wouldn't your hair tell it?
Right.
You eating, you feeding this. So think if you got a poor diet, I hate the word diet, but that, then your hair is going to produce what you put in it.
Right.
Okay, so we've got to be extra careful. So, Dr. B, did you want to add anything to why could COVID-19 cause hair loss?
Well, one thing that I wanted to go back to, I like what Marguerite said earlier, talking about, the area, and then Pam, well, Marguerite said, and then Pam chimed in with the private area, so what if you are a practitioner and you're dealing with, say, someone who's suffering with the hair loss due to COVID, but you don't have a private area? What
Mm.
in,
Mhm.
because now, like Pam said, well, you try to get them to come in early. You try to accommodate them as best you can. But like Marguerite said, the important thing for them to understand is that in order for you to provide an adequate solution, they have to provide you all the information.
That's good.
Right.
Yeah.
Right.
Information
Yeah.
does not benefit them in any, sense. So like for me, I've never worked where I had a private area, but I've also always kept myself away from the most traffic. Sorry, that's
Like that.
something somebody done bang on the door or whatever. But I've kept myself away from the most trafficked areas so that I can speak quietly and speak more directly to the person, but always letting them know that they have to provide all the information to me. So, like you said, we need to know about the diet, we need to know about the medication, we need to know
Mhm.
about the lifestyle, all those things to be able to gather the information that we need to most adequately help them. And so, I think that's a great point that we have to continue to drive. Especially when we're dealing now with this new situation, which is the hair loss due to COVID, that we know we're going to start seeing a lot more. As Marguerite brought out earlier, you don't generally see the effects at least for like 3 months, right? So
Okay.
people who are going through it, and now we know that we have these increased cases, we're going to start to see it a lot more. This is something that we should be studying so that because we know in the coming months, we're going to see that increase as our clients
Right.
take the vaccine, they feel more comfortable to come back out. We're going to start seeing it in the salons a lot more. So we have to be able to adequately address it when we are confronted with it.
That's good. So, you know, this is really good. And I'm going to get to the end of this. Here's the last question. This is quick. We all can agree to this or disagree. It says, is hair loss associated with severe COVID-19? Well, that's a no-brainer. That's a no-brainer. That's a no-brainer. But I had to hit the question because it was right here. That's a no-brainer. Actually, they've been doing a study dealing with severe COVID survivors. So we're not talking about the people that didn't make it. That's, but the severe cases where people are still, they were able to go home, but they got this breathing issue. You know what I'm saying? They got all these, the body has been just totally knocked out of the norm. So now they've got to live a certain way on oxygen and different things like that. So here it is. They were talking about a study they did. And they were talking about this was an evaluation they did with 175 people that was hospitalized with COVID-19. Okay, so they did like an analyzation. These people that were able to go back home, they suffered severe hair loss almost immediately. Almost, and y'all listen, don't get it twisted. We talk about medicine, we talk about everything. We are really hammering in on emotion, stress. Those things are real. And they can cause the body to react in such a way that it's not conducive for life. Okay.
And then they lose their nutriments. They loses all of that. So all that stuff have to play a part. You have to gain all that stuff, all the things that you lost due to the COVID and being sick. You have to replenish that stuff.
Yes, yes. So
and then also too, with like what you just said with the oxygen, oxygen helps circulate. It helps circulate our blood and stuff to our cells and our follicles of our hair. So if our oxygen is limited, normally that's the last place that's going to actually get any type of feeding from your circulation is the follicles of the hair.
And we need
that's another thing that causes thinning, and we need it.
That oxygen. And those that listen, if you do steaming in your facility, if you have a client that have been experiencing any type of dehydration, I'm laughing because my hair is dry. I was suffering. So I had to do my own little treatment. Oh, and to put the icing on the cake, this is a freebie for those that's listening. Students, you on here, I'm helping you. Here's another thing too. We're talking about COVID. Those of you that like sodas, y'all, let me tell you, the yeast in these drinks that we're drinking, that Ms. Robinson loves so much, is causing situations where we're having yeast on our scalps, okay? So I experienced that firsthand, okay? And I had to go back and analyze what I was putting in my body. And I realized that was my number one problem. So I said that to say this, as much as I like to drink them, I don't like to scratch as much as I've been scratching in this one spot. So you have to make a conscious effort. And I'm saying to get the help that you need and follow the regimens that the professionals give you. We can agree to it, and I'm a professional and know that that's a no-no. So I'm saying that to let you know, if I think that I can break the rules because I think I can go back and fix it, I'm not using wisdom either. So I'm employing what I've gone through to help someone else. Hey, let's not fool ourselves. Let's get the help that we need. If there were some questions that you have, please, I know you should have some questions. We should be overran with questions because nobody has taken time out to talk about this subject. We talked about COVID and keeping your hands clean and You know what I'm saying? Go get you some Clorox and go get you some spray. We done did all that. But we haven't talked about this issue that we're facing right now. And you know what? If we deal with it, we can help. We can help. So once again, this has been Let's Talk About It Tuesday. This conversation has been most fulfilling for me because I'm going to take it personal and I'm going to help myself as well. So I think if you look in the comment box, it has information of each one of us on this platform. So if you're looking for help in whatever area you're in, please reach out and get answers because the answers are out there. The only way you don't get them, you didn't ask, okay? So, I mean, I'm seeing people at the grocery store now. I went earlier and this lady was standing right in front of me. She has beautiful hair here, but I can see straight through there. I wanted to touch her so bad, but it looked like she was going through this situation. And you got to use godly wisdom before you touch people.
Yeah.
So, y'all, it's happening. It's happening. You ain't got to be old. It's happening. It's happening to children. So let's
Yes.
wise up, wake up, get up, and move forward, okay? So I have enjoyed myself. I'm gonna let Dr. B take us out because, before I do this, Dr. B, I got to thank my sponsors. Y'all, we have sponsors. We want to thank Platinum Beauty Supply Store in the Centerpoint area. I think Mr. Reverend Robinson has put the information in there. So please, let's support our local beauty supply stores. Hey, got to talk about the lip gloss. I see Pam glossing up. This is Pretty Gloss Princess. Hi. She is one of my best sponsors. She's 10 years old. I'm gonna keep telling y'all that. So some of y'all that's 50, 35, and ain't thinking about starting a business, she 10. She 10, and she makes her own products. And Pam got a chance to put some on them luscious lips.
Love it.
Dr. B, she got some for you guys. I'm gonna sing you some. She got the lip scrubs and these beautiful lashes, okay? So I want to thank her. Was there anyone else, Donnie, that I left out? And my church, of course, which is Kingdom Dominion Worship Ministries. I got to give a shout out to them because there are some, you got to give shout out to your supporters and to you for tuning in each week to make Let's Talk About It what it is. And we appreciate you so much. And now I'm going to put it in the hands of Dr. B.
Okay. Well, again, we want to say thank you so much for everybody joining us this evening. We had a riveting conversation. And as we come back next week, we have a great topic. We're going to kind of interweave what we talked about this week into next week. So next week, we're going to talk about some of the solutions for the hair loss. And we're going to look at some of the various commonly known products and see how they have been working for those who have been suffering with COVID-related hair loss.
Oh, that's good. That's good. You don't want to miss this. You got to tune in. And Marguerite, I want to thank you. You're welcome. We hope to see you next week too.
Okay.
The more the merrier. And your information that you shared along with our topic was phenomenal. And we appreciate it. We appreciate it. No man's an island. We need each other. And this is how we're going to make this work. So once again, we'll see you, if God says the same, on this platform next week. Tell a friend, send them, bring them, sit them next to you, get on here, ask questions, you guys. Talk to you later. And listen, go to YouTube if you want to see this again. It's on our P2P Ham YouTube. Y'all start subscribing. Please do so. Thank you. Like and share. Talk to you later.
Bye.
Bye-bye.